Hello everyone, I am Dr. Suraj Narasimhan, consultant interventional cardiologist and structural interventional specialist working in Narayana Health, Bengaluru. So there are two kinds of ways where we can replace the aortic valve. One is called as the surgical aortic valve replacement. The other one is called as the transcatheter aortic valve implantation or TAVI. The surgical aortic valve replacement is one wherein we do cut open the chest, open the heart and then take out the deceased valve and then put in a new valve, stitch it and then close the chest. So this is what is called as the surgical aortic valve replacement. This surgical aortic valve replacement should be done in an operation theatre where the patient is put under general anesthesia and it requires to stop the heart while doing the procedure. The patient goes on a machine called as the bypass heart-lung machine and then the heart is stopped. We cut open the valve which is deceased, take it out, put in a new valve, stitch it and then you restart the heart and then coming out of the lung bypass machine and finally we close the chest. So this is the contemporary method of replacing the aortic valve which has been there for a long time. Coming to the second option which is called as the transcatheter aortic valve implantation. The transcatheter aortic valve implantation is a simpler procedure which is done under local anesthesia in cath lab, not in operation theatre where the patient is actually fully awake during the procedure. We just give an injection in the leg where we make sure that that area alone becomes numb and then we put a small hole through the leg and then we take a catheter all the way from the blood vessel supplying the leg into the aortic valve and after that this narrowed valve is opened up with a balloon and next step is to actually put in a new valve which is crimped over a balloon, keep it in the appropriate position and then we implant this valve in the beating heart itself. So this is called as the transcatheter aortic valve implantation, which is a much simpler procedure which can be completed within 45 minutes to 1 hour time and it is done under local anesthesia and it is a more easier way and a painless way of treating aortic valve disease. And usually these patients who undergo surgery might require hospitalization for almost a week and ICU care for almost 2 to 3 days. But then in transcatheter aortic valve implantation, the procedure is completed within 45 minutes to 1 hour. The patient goes to CCU and they are kept under observation for around 12 hours and then they will be immediately shifted. The patient will be walking just after 12 hours of procedure and this patient will be discharged probably within 48 hours of the procedure if everything goes well.